right, hey guys, thanks for joining us today. We're here to talk about some of the role of modern identity technology in healthcare. It's one of, I think, all three of our favorite topics. So I'll introduce you in a second to Aubrey and Rob as well, just because of the complexities that happen in healthcare. They've always been tough with identity. They got tougher at COVID, and then we're seeing a lot of things happening post-COVID with like just some pandemic fatigue as well that makes it hard once again. And that comes from M&As, from the complexities of multi-persona users, where you've got to deal with providers and caregivers and students who are often all the same human. So dealing with all those things on top of legacy systems that healthcare applications have been built on, transforming those, while also taking care of your actual patients, and dealing with regulations that are ever evolving in the space too. So just real quick, my name is Aaron Lintz. I am our VP of Strategy and Advisory at IC Consults. I manage all of our advisory engagements, pre-sales sort of activities to ensure we're providing proper strategy up front, and then also the delivery on our engagements as well at IC Consult. So it's sort of like continuity start to finish of strategy and advisory for all of our clients. I've been in the space for about 12 years. A couple of housekeeping items I just wanted to talk through is everybody should be muted, but we do want to hear from you. So if you have questions as we go through this, we'll stop essentially at least twice throughout this. We'll stop halfway to see what questions people have, because we'd much rather talk about things you care about, and then we'll do the same thing in the last handful of minutes. But let's transfer over to Rob here to introduce himself.
Yeah, thanks, Aaron. Hi, everyone. My name is Rob Sebaugh. I'm the healthcare identity strategist for SailPoint. A little history on me. I joined this organization, we'll say roughly a year ago, coming from being a customer, right? So I was running an identity shop for, we'll just say the largest provider of government-funded health insurance in the United States. So, you know, looking across, I had purview of our governance capabilities like SailPoint provides, our solutions like Ping provides, and several other things in the MFA rather, and kind of identity integration spaces. I have almost 20 years in IT at this point, and looking forward to the discussion today. Aubrey, I'll turn it over to you.
Thanks, Rob and Aaron. Yeah, so my name is Aubrey Turner. I lead the executive advisor practice at Ping Identity. What we do is really insights and enablement for our customers and prospects. So we provide strategic guidance, let's say. We are always striving to answer customer questions, and one of the most prevalent that I hear all the time is, you know, what are others doing, what's working, what's not? What should I be paying attention to in identity and cybersecurity? You know, how does the ecosystem work? How do the puzzle pieces fit together? How to optimize? And so, again, focused on sharing insights, you know, even down to the specific use case level. So some of the topics that we're tackling, you know, these days, the journey to passwordless, you know, cloud, zero trust, you know, customer identity access management, and a host of other things that are so important to our customers now and going forward. I've got about 20 years of cyber and identity experience, and like my fellow panelists, look forward to this conversation and you know, kind of sharing and collaborating, and hopefully you know, having some insights for the audience relative to things that we're seeing, and how you can optimize, you know, your journey from a healthcare perspective.
Cool. Thanks, Rob. Thanks, Aubrey. So all three of us, we talk with our clients all the time, so we like to talk. So I do just want to reiterate, ask questions as we go through. We'd love to hit some topics you want to hear about. We're also all pretty visual people, so this is sort of a fireside chat in the sense that we'll just sort of talk through various topics of the space. I'll sort of play MC a little bit on that so we can hear from Aubrey and Rob. But because we're visual, I think let's start maybe with this slide that comes from SailPoint about just some healthcare trends. And maybe, Rob, since it comes from SailPoint, why don't you maybe first take a stab at just sort of talking through this, and I'd love to hear some of Aubrey's thoughts on it as well.
Yeah, great. Thank you. So look, I thought it would be good, or we thought it would be good to really try to frame out what we see as, we'll call, the unique challenges in healthcare, right? Some of these apply broader to other industries, but I think if we're all honest with ourselves, healthcare finds a way to be just a bit more unique in that, look, it's not what's regulated, like everything's regulated, right? We've got to not only pass audits, but for good reason. We've got to find ways to control security, control access. I also know that if I'm a patient in the ER, I really don't care if I don't want IT to be in the way of me getting service, right? But I do care that the person providing service is credentialed and validated and things like that, right? So some of the common things, so if you look at this, with, kind of starting in the upper left, we'll talk about multiple authoritative sources. In healthcare, it's really common to see, sort of a source of employees coming from HR. It could be like a Workday as an example. Those employees get shifted into, we'll say, an identity platform like SailPoint provides, but in a general sense, it's the event driver for action to occur on that identity, for the creation of an identity, for email, for whatever, right? The catch in healthcare is, look, we're one mortal person, but we, as a provider, potentially perform multiple roles, right? I might be in one facility 2 days a week. I might be in a different facility 3 days a week. I might functionally work in the ER 1 month, or 1 weekend a month, all these various things. It further complicates when you think about like an academic teaching hospital that then has not just authoritative sources from an HR perspective, but you've then got student populations in a different resource. You've got multiple student populations depending upon those affiliations. You have contracted physicians in another source, et cetera, right? So there's that sort of color correlation, if you will, that blue to blue, although it's all blue in front of us. Multiple authoritative sources to multiple roles per single identity. Just a couple other data points on here. Another big thing that we're seeing in healthcare is, look, IoT's become a huge thing, right? You think about insulin pumps, you think about pacemakers, whatever. Not all of that data can be directly correlated back to a patient, but oftentimes some of it can. And so you have what you might consider unstructured data that sits at rest, that certain individuals have access to, and you have to find ways to govern that. For good reasons, a physician might extract data from an EHR like Epic, work on a care plan, pass that over to someone else. Now that data is at rest. We have to find ways to look at how do we govern not just applications, but also data associated, who has access, why do they have access, what are they doing with that access. And then finally, the other big kind of shift we've seen pre-pandemic, but really the pandemic accelerated it, is a ton of cloud adoption. I think traditionally, and my cohorts on this call probably agree, healthcare's a bit behind the curve in terms of adoption when it comes to certain strategies, right? There's a reason to keep things behind the four walls. The pandemic stressed that quite a bit. We moved people remote. We had to find ways to allow people access to things in ways we hadn't done before. We see SaaS services taking off as a big thing. We also see a lot more merger and acquisition, and this drives then, it's really in most cases the desire to extend that continuum of care, but in order to actually rationalize on those investments and see the real value, we as identity technologists have to find ways, and oftentimes creative ways, to securely allow users from an acquired domain to access things at the new parent domain. So all of these complexities, coupled with dated technology, oftentimes and just a large set of regulation and identity types, identity populations, really stresses the system, so to speak, right? So Aubrey, I'll see if you have any comments to say on here as well.
Yeah, Rob, I'll add a few things, and I'll come at it from a couple different angles, kind of one, the future of healthcare, and kind of some of the things that we're seeing now. So we know that there's a tremendous amount of growth in telemedicine, kind of retail outlets, sort of non-traditional entities, kind of getting into the healthcare space with varying levels of success. And so that obviously, does present a challenge. And, we saw telemedicine grow as you pointed out, due to the pandemic. We needed to consume healthcare in a different model. I think consumer behavior is also changing. Some of the value-based care models. You and I and Aaron and everybody else kind of taking more ownership of our own healthcare outcomes and being incented to do that. But think about, personalized medicine, IoT, that is again personalized to you and I, and the implications from all the data and securing all of that, and securing the particular device itself. Let's say it's some kind of device that is tracking particular healthcare measures, and where that data lives and who has access to it. And we've heard some horror stories relative to like pacemakers, and the password is admin, and if somebody got a hold of that, like what could they potentially do to somebody's pacemaker that's literally keeping them alive. So sort of all these things, the confluence, the speed at which technology is moving, and the ability for healthcare to keep up, the ability for healthcare to make sure all those things are secure. I think 2023, we've already seen, one of the largest breaches. What are we, 90 plus days into 2023? I think, one of the largest breaches so far this year is, healthcare. The past couple of weeks, I've been at a couple conferences, and healthcare, some of the keynotes and some others, a lot of the conversation is dominated by some of the challenges healthcare faces relative to securing, really sensitive information. Again, one of those, large breaches this year of a healthcare, I think a hospital, followed very quickly by class action lawsuit. So people are, not just saying, hey, you've been careless, but you've been negligent potentially, and now, there's, class action lawsuit. I believe that's actually coming out of California. And if you think about the 24 billion, before I get to that, one other point, healthcare by industry is the largest workforce in the United States. So naturally, that's, that also means that there's, naturally going to be a lot of target. Healthcare is going to be a target for bad actors and so forth. And where I was going, and I'll move on after this, is there are about 24 billion, I think by last count, user ID and password combinations on the dark web for sale, some of them with associated information. I can't say how much of that comes from healthcare breaches, but I have to imagine just the value of that data, that a lot of it does. And so threat actors, bad actors are targeting, healthcare for those reasons, because that data, again, has value. So lots of challenges, right? Lots of challenges being faced in the industry. I'll flip it back to Aaron, and Aaron, I don't know if you want to put a bow on that from some of your experiences, but yeah, I'll pass it to you.
Yeah, thanks. I'd say, one, looking at this slide, I'm going to try my best to sort of ask some questions that revolve around, as much as I can, we hit on all 8 of these topics, and maybe somewhat put a flavor on that around the breach and the security piece. Also, maybe hoping to talk through a couple of big themes as we go through this, and try to resonate a little bit of just what healthcare is looking like today versus 5 years ago, right? So some of these have been themes for a long time, not all of them, but they've evolved. And so maybe we talk a little bit too about just what I'm going to talk to healthcare providers as clients. We see this concept of sort of like this pandemic fatigue. So people are very tired. They worked really hard to upgrade their systems to provide patient care quickly, and a lot happened on security and information technology teams, application owners, But the good thing about that is it also became very eye-opening for a lot of organizations of what they hadn't been doing and should have been doing for a long time. And to be honest, regulations do not really cover most of what should be done from an identity perspective. There's a lot left to be done. There's just only so much organizations can do to catch up. So I certainly want to talk about and sort of keep that in the back of our minds as we go through this conversation, as people are tired. But how do we still, despite being tired, leverage that attention that identity has finally gotten in the healthcare space and do things meaningful to the business? And then the second thing to sort of just talk through that I'm seeing a lot of, and it's not just healthcare, but it's especially predominant in healthcare, is there are some economic pressures happening. So just from, hey, we don't have a lot of, we're trying to mitigate costs, or are being cost conscious on things just for wherever the economy may go. There's still workforce shortages in healthcare. After, especially coming out of the pandemic, people not knowing what they want to do. So there's a human piece, right? You can't solve workforce shortages necessarily 100% with ones and zeros by just doing applications or installing cool tools, right? So still workforce shortages. So how do we build operational improvements through identity to help mitigate some of that? And there's still supply chain challenges too. We're probably not going to go into that today, but in the healthcare industry, right, when we talk about things beyond just providers, we talk about suppliers, we talk about health insurance and how all these things together. We'll probably do a whole other webinar on that. But those are sort of like that triple squeeze sort of concept. But let's try to focus in on, sure, like some of the bad news is we've got some fatigue, but we've got some economic pressures. But there's a lot of good news in the sense of the tools, the identity tools that are out there have evolved rapidly to meet these demands. And companies and private equity companies have invested in companies like Ping and SailPoint so that their workflows, how they think and innovate against healthcare have also improved. So just sort of like some resonating themes around this. I thought maybe we'd start with that bottom right. Maybe we can get rid of the slide here too, Ely, but that multi-user types. This is a long standing sort of problem in healthcare. And again, with investment in tools in this space and the evolution of those that we just talked about, I think it's gotten a little easier. So we've got multiple personas that are out there. And there's a lot of blurry line of knowing who's who and who should have access to what. And so maybe I'll start with you, Aubrey, from like an access management perspective. What have you seen Ping and even maybe just organizations outside of the tool do to help handle multi-user, multi-persona type ecosystems?
Yeah, and I'll definitely kind of tread carefully here. This was a space that I used to spend a lot of time in. I definitely will kind of cover kind of my high level perspective, and then certainly kind of be curious to hear what Rob has to say, given his background. But that's been an ongoing challenge, right? Since I can remember, since being in identity, and it's particularly noticeable in healthcare. And Rob touched on this, right? You've got that teaching hospital that has folks that are going between multiple roles or multiple locations and differing access. And so from an access perspective, we've been able to alleviate some of how the ease of actual somebody logging in, right? They can log in once and they can kind of have an extended session if that's appropriate. Where identity has evolved to and where it is evolving to, we can leverage biometrics, things like that where appropriate. Obviously, there are certain situations, and Rob made a good point. I think, like, hey, I'm in the ER, I've got an emergency, I don't need the doctor or whoever it is fumbling around for their username and password to log into something, right? Or they've got a mask on and they obviously facial biometric is not going to work in that situation, generally speaking. So it's got to be appropriate. But the thing that has happened that's really, really good is we can have various options that are appropriate given the context of the somebody accessing the environment or accessing a system. It's probably earlier, that same person would probably have multiple logins to remember, and we know how well that goes. They probably use the same one for every single one of them, and as easy as possible, like password or 1 2 3 4 5, whatever, with an exclamation point or something. We've evolved to role-based access control in some of those models. Then you sometimes bring about a role explosion, which obviously is a sort of a kind of a negative consequence potentially of leveraging RBAC to figure out under what circumstances or situations somebody should have access. I think in addition to sort of the evolution of the various options that we can leverage, Bluetooth, tap and go, near field, biometrics, having those options for the different groups that are in a healthcare scenario. I think AI and ML has probably been the other big technological advance that can help us deal with the multi-persona challenge that is so endemic or so relative to healthcare. I'm gonna definitely ask Rob here in a second to shed his light or give his perspective on that. But I think our ability to leverage something like RBAC, as well as things like dynamic authorization and policy-based access controls, driven off of again those policies and conditions and attributes, we can again solve that multi-persona problem. I don't know if it's ever going to be 100% fully solved, but where identity is coming from to where it is today and where it is going in the future, we have the right pieces to deliver a better experience and I think solve that challenge in a much more meaningful way than ever before. So I'll kick it to Rob, because I think this audience would really like to understand how AI and ML can help from a governance perspective, or whatever Rob wants to say there, can help with this particular challenge. Rob?
Yeah, so I'll definitely, we'll get into AI and ML for sure. The one thing I want to piggyback on, and you said the word right at the end, you said experience, right? So it is my firm belief that identity programs live and die on the vine based on end user experience and adoption, right? We as IT professionals put together a process for good reason that oftentimes is not well received, not well understood, not well followed. To your point, right, what will people do with multiple IDs? Not only will they use the same password, but they'll write it down and put it on a sticky note on their monitor or whatever. Because look, when you're dealing with 100 patients overnight, and trying to manage everything, you don't have time for technology to be a barrier. And I think from an InfoSec perspective in general, we've seen a big shift from being sort of the brick wall that says no to really trying to be an enablement element of an organization, right? We want to help people do what they need to do as securely as possible. But sometimes that does mean trade-off, right? Sometimes that means accepting a risk in lieu of a better experience, right? So we can continue to collaborate, and I would echo looking at just the fact that SailPoint and Ping, as an example, are talking on this call. There is no one software, no one vendor, no one thing that gets you to that utopia of security, of that end user experience and environment. Everyone tends to be unique, but the collaboration between these companies is so critical, right? And frankly, that's then how you get to evolutions in things like AI and ML. I'd imagine there's at least a couple folks on the call that might be kind of tired of those terms, and I don't blame you. They are buzzwords, but let's be honest, right? When you think about the complexity of doing an RBAC model, a role-based model manually, how complicated it is to keep up to date, how much workforce and effort it takes to keep current, and then do your certifications and everything on top of that. There's certainly capabilities to help you, But what is more intriguing and what most companies can't really even answer with that type of technology in place is, what does bad access actually look like? And then how do you find it, right? The point was made, I think Aaron might have said it a little bit ago, governance is great, and passing an audit is great, but governance doesn't mean you're secure, right? If we've presented somebody with a user access review that has a whole bunch of terms on it that you can't understand, what's a clinician going to do, right? And rightfully so. Select all, approve, right? Who's going to take the time to go entitlement by entitlement or role by role and certify their 10 team members across 50 different things? The AI and ML piece that's really interesting is when you can start driving information to that reviewer to make a better decision, to say, hey, based on pure insights, these 5 are probably safe to approve because it looks like everybody seems to have these in this organization, and we can say with some relative certainty that it's okay. But this is an outlier and you should probably go look at this one, and here's why, right? And then you start to think about upstream when you're interacting with customers and clients and whomever else may interact with your data, third-party supply chain as an example. You want to find ways to better inform yourself of what they're doing and better inform them of what they may be doing right or wrong, right? And again, without the technology underneath to really do that sort of data mining and awareness, it's really difficult to do manually. We don't have the option to do things manually anymore. My 2 cents.
That's good. Those are good thoughts. I think those are a lot of good thoughts on like that whole idea of where we deal with identity and the multiple personas and all the things you guys expanded on, especially around the governance piece there, Rob. I did want to just touch on a couple of like more leading trends that are happening from an identity perspective. And this is probably more access management related, so maybe this is for you, Aubrey. Of course, Rob, same thoughts though, but we're trying to focus in on, in the last decade or so of an identity for healthcare, is how do we stop some of those malicious actors when it's easier for them to find tiny holes versus us sort of trying to block and tackle all over the organization. And one of the ways that I've been seeing a lot of organizations move towards is like identity verification. So there's certainly like those concepts of MFA and stuff too that have been sort of advanced pretty strongly for a lot of organizations and required for healthcare. But for like verification piece, Aubrey, what are you starting to see from verification and like things like verifiable claims and things like that too?
Yeah, there's a number of things there, Aaron. So I'll start with the idea, the concept of identity verification, identity proofing, and it's been around for some time, but it is really starting to ramp up and accelerate, particularly again, right? We'll go back to the pandemic. The pandemic ushered in and forced a lot of accelerated a lot of people's digital transformation plans. It's forcing a lot of people to really embrace digital, and whether you believe or advocate digital transformation, whatever you want to call it. Some of those changes are here to stay. Some of those adaptations really around identity proofing. This is the idea that you're going to start to see more of this. Certainly already seeing it in financial services. Think about opening a new account or for transactions, or if something just seems wrong, you may be taken through this process where there's a selfie capture. It could be passive or active. Then it takes you and compares it to a government ID, such as driver's license, passport, or some state issued form of identification. And there's a selfie match with that liveness check. And you are verified and authenticated, and then you can kind of continue with your transaction. Again, could be account opening. Here in the United States, obviously there's been some challenges around, a national sort of patient identifier. People have, kind of moved away from trying to use social security number, although some of that data is still there. The point is, though, in terms of the sort of highest level of assurance, this is where businesses are going to land on a lot more of this. We're going to see a lot more of this from a healthcare perspective, not only as all of us and our listeners as patients, but think about somebody who's a traveling doctor or nurse, has a license from a state board or whatever it is to practice medicine. They need to be credentialed in order to provide care. Having the ability to verify that person's identity. And the other thing that you touched on is that verifiable claims piece. Now, the lines between sort of authentication, between identification, identity, and authentication are blurring, as well as even authorizations. Those things are kind of all coming together. And kind of, we're kind of in a post-authentication world where we need to not only take some of the things that the rigorous, robust activities we're doing in identity and authentication and take them into authorization. What I mean by that is that verifiable claim that you are a credentialed, caregiver or nurse, doctor, whatever it is, lives, either in the cloud, probably on a mobile device, a smartphone, could be some other physical device like a security key, but that can be presented and it's portable and reusable. And again, has the sort of highest level of assurance that the issuer, due to some things around device security, as well as PKI and some other things, we can have the highest level of assurance that that is me, that is logging into my healthcare accounts, or that is me, and I am a doctor and I can administer care, where I'm entitled to do that. And again, just makes, and back to Rob's point, makes that whole experience, both for the patient as well as the staff, a lot easier, a lot faster, a lot simpler, with a higher level of assurance from a security and identity perspective that this person is who they're claiming to be, and that they are in fact properly authenticated and authorized, again, to administer care, or authorized to see the results of somebody's tests or whatever it is, right? I know I said a lot there, but the point really is that identity proofing, identity verification, and not only from a document-centric perspective, there are other forms of it, right? Voice has kind of come and gone, and we've kind of seen it, kind of voice authentication. You'll find it in financial services. I think paired with some other things, you'll start to maybe see voice be another option. For certain circumstances, my name, email address, and phone number in combination can provide a high level of assurance that is in fact Aubrey, Rob, or Aaron, right?
Mm-hmm.
So again, based on the circumstance, these types of information can be used paired with other signals to, again, verify that somebody is who they're claiming to be, and then extend them whatever service it is that they're trying to do. So really exciting times. And again, I just want to caution people. By the way, last point here, there is some opposition, right, to naturally, right, with any new technology or technology that is becoming more widely adopted, there are concerns about privacy and where the data is stored, and trust me, mistakes will be made. You're going to see some lawsuits. You're going to see some things. There are some opposing forces. Some of the technology is misunderstood in terms of how it's deployed. But I think ultimately, again, in terms of like some of the information I talked about that is on the dark web, this is one of the ways that we can make that information less valuable in terms of some of these modern verification and authorization approaches. Will mean that data, that those attributes can't be used as easily against us to, again, do account takeover and some of the things. So Rob, I'd love to hear what you have to say on that as well.
I mean, to be completely candid, you covered a lot of ground. That's I mean, look, there continues to be I guess what I would just kind of reiterate, there continues to be a need for better security. That security, to the point earlier, has to be something that can be adopted by an end user, and an end user know that, look, whatever they're giving up as personal information is held sacred, right? Is that it's not being used in any malicious way, and that we're doing our best to protect that. Again, technology continues to advance. Our ability to do things beyond just react to a problem, we're getting much better, I think, in the identity space of being more in that detection and prevention space, right? Really focusing on making sure, like you said, that people are who they say they are, and they're accurately accessing only what they actually need, right? Again, not to keep using buzzwords, right? Zero trust is a thing. Again, there's no one technology that gets you there, but the real general concept is trust nothing, verify everything, right? And we have to find ways to do that programmatically. And I think ping tends to be at the forefront of how that's being managed outward, right? Especially in proofing. And SailPoint's really looking at beyond just governance of an individual and managing what they have. What else do I know about them to continue to certify? What else can I integrate with? Actually, something that is an interesting thing to put out there for anybody that wants to go look it up is shared signals, right? I think this is another example of the evolution of cybersecurity in general. I think traditionally, every tool set wanted to keep every piece of data it had on lockdown. We didn't want to share it. And then along came, concepts like a SIM, where we want to put log data and event data in one place, where now we can kind of have an idea, a security operations center can see what's going on. But even that is enclaved, right? Shared signals moves more towards that shared event approach where, oh, we just terminated somebody for some negative reason, and we need to make sure they don't take some negative recourse. So we're going to inform the identity platform to shut off access. We're going to tell ping to kill any known active sessions. We're going to, turn off VPN as a capability. Like that concept of, pub sub messaging, if you will, to actually secure that element at that moment, right? So again, it stretches a little bit the conversation and the question, but really focusing on how we get better at working together, right?
Right. I like that last bit. The working together piece is good, both between the products, but then across like everything. It's like across healthcare providers, the relationships between the user personas. And you just guys kind of made me think about this a little bit. All three of these companies, Ping, IC Consult, and SailPoint, are all global companies. I work with a lot of our consulting staff out of Europe, and how like GDPR is like healthcare is affected by GDPR. But it is interesting when I'm going to get to a question here in just a second, but it's interesting how much identity seems to be table stakes in Europe than it is in the US. I personally speculate, this is totally subjective, that a lot of that has to do with things like the resistance that both of you guys talked about, the resistance to adopting like certain protocols. A lot of that's lack of education. And the second thing I think it's a lot to do with is job churn. So every time a new CISO shows up, they're comfortable with one tool or another. They've seen certain things. And it's not just CISOs, everybody, right? You're having to spend all this time dealing with the headaches of the old technology, and how do you resolve that? And so you guys are talking about things that would have been great to have had for a long time out of these technologies. And some of them, as Aubrey mentioned, like identity verification, is not new. MFA, when it was getting adopted in like forced regulation, wasn't new then either. And so I'd love some of y'all's thoughts on how do we help enable our audience to advance what they have and to help educate folks. And maybe some of that's out of their control, right? Because like as a patient, I mean, I had to go get stitches the other day, and had to redo my tetanus shot because I could not remember when I got my tetanus shot. And I know there's like 7-year data cleanup rules and stuff like that, right? But still, like how much easier it would have been if I just had a record, an ID I could have shown. So what are you guys seeing, or do y'all have thoughts on that too? I don't really have a great question on that, but what are you guys seeing around how do we really push the envelope forward and circumvent some of the resistance we see?
So I'll be short, right? I think, man, I think healthcare has made strides towards that in the last decade, right? And look, long way to go. The medical technology is insane, right? What can be done, procedures that can be done, the research being done, everything around it is insane. When we think about, the same result in terms of technology, like just consider what the electronic health record has done, right? The ability to start sharing information across, and in many cases, depending upon what EHR you're using, you're hosting that for other like rural hospitals in your area that maybe can't afford it, right? So it's this sort of data web of things, but then in comes the security guys that say, whoa, let's not share all this stuff. Let's close it off. I think actually what's happening though is health systems are realizing, at least the customers I talk to on a regular basis, are realizing that they don't get to be the blocker. Again, kind of the point, I know I've said it already, but we have to find a way to enable that. And I think as Aubrey stated, the innovations from companies like Ping and SailPoint have been incredible. And there's more than just us, right? There's plenty of organizations that are out there focused on how to make this better and innovate in the space. Aubrey, I'll turn it over. Do you have any thoughts on that?
Yeah, obviously from a healthcare perspective, the main focus is better patient outcomes, right? That's the primary, sort of responsibility. Hospitals and sort of the larger healthcare, from payers and providers and everybody that's involved. Ultimately, hopefully what we're all seeking is better patient outcomes. I think in terms of the tools and methods and the people enabling them to deliver those better outcomes, I think from an identity perspective, it's always been about sitting back and having some kind of vision and strategy for what type of, and Rob, you said this again, so I'm just going to go back to it because I think it's important. What type of experience are you going to deliver, whether it's for a patient or even a staff and or a doctor or nurse, whoever it is, right? I'll even throw pharmacists in there as well, right? How are you going to enable them to do their jobs better? Identity as a lever that can be pulled from a digital transformation perspective. We touched on cloud before. Hey, you're going to cloud. Let's not create more identity silos and create more username and passwords for people to remember. Let's build an identity control plane that, again, makes it easy for people to still access those applications regardless of where they live. Let's use adaptive MFA that is intelligent and smart. Let's use risk signals to make sure that we're not prompting those users unnecessarily for MFA if their risk profile, risk score hasn't changed. Let's pull together signals from the device, the endpoint. Let's pull signals, role, other information from SailPoint, and leverage that again to determine what people can access. Because like, hey, the whole idea, I've knocked on your digital front door, and the question is like, hey, now I'm inside, like, what can I do? And there's data that we can use to dictate what that experience is. But kind of going back to that, understanding kind of what the vision is, what these different components and tools are, doing tools rationalization. Oftentimes, when I was in consulting, spent a lot of time working with Aaron. We've walked in many a door of many a company and kind of looked at what they had, and in many cases, they're just, the thought is, and this could be a new CISO or somebody coming in or a leader wants to rip and replace everything, and we sometimes have to say, well, hold on a second. let's at least figure out what you have and how it's being used, how it's being optimized, and let's kind of rationalize that against what your vision is or what the strategy is. Oh, by the way, we can tell you what the best practices of leading organizations are doing to solve these problems, and we'll leave it up to you as to whether or not you are you the tip of the spear, or are you kind of leading from behind, whatever it is, right? We can align you against those various benchmarks, and we can work with you to figure out like what makes sense. But I think there's tremendous opportunity in healthcare. One of the things I ask myself is, we've occasionally it'll pop up in the news that a hospital is spending, $300 million on a deployment of an EMR, and the first question that pops in my head, other than that, wow, that's a lot of money, is I wonder how much of that is security related. How much of that budget is associated with security and user experience? Not my place to tell them how to spend their money, but I can't help but wonder how much of that is really allocated to security and transforming the experience. So I'll kind of pause there. I know I kind of said a lot relative to rationalizing a program and looking, having a vision, executing that against security and convenience, and again how budgets may be allocated to deliver these outcomes. But hopefully there's a few nuggets in there for our listeners to kind of have as takeaways.
Well, I think it's certainly helpful, and I was sort of looking at the GoToMeeting for questions here, and I'm going to try to mesh a couple things you just said with what I'm thinking from this looking at the questions. Is I spent some time on the cost piece, looking at Gartner, and now they can't pull everybody, but they did talk about some spend priorities for healthcare, and now they don't have like an EMR specific line item, which is interesting to me, but they do talk through all. I think it's because it's bucketed across like lots of themes, but cybersecurity and data analytics were two of the top spins when talking to CIOs, which was promising in a lot of ways. But I also, just based on some like what I'm reading here too, is thinking about like the legacy tools that are out there, and so there is a cost to removing those tools. Sort of in prep for this meeting, we were talking about like the healthcare version of Y2K was when XP started losing support. Like suddenly we have to fix all of these applications. We got to replace all these devices built on XP, asking for extensions, all that kind of stuff that happened. So what I'd like to think about as people are investing in identity and infrastructure, what do you see the best way to invest the time spent, right? What are you seeing as I'm looking to integrate still with legacy apps or with new apps, what protocols are you seeing to make that easier? I mean, I think both of the Ping and SailPoint platforms are trending to more workflow driven integrations that can certainly do custom integrations, right? But it simplifies the cost of deployment because of these open standard protocols of moving away from legacy systems. We still have a huge deal with M&As that are happening and data growth too, that require like, hey, well, we just invested this time to like connect, or we've got to connect to another system, or we've got to consolidate systems. So from both SailPoint and Ping's perspective, like I said, I've seen great things coming out, but what are you seeing in that standardization of connectivity to integration with applications, so that our listeners can make sure they're investing those dollars, right, that spend in the right ways?
Sure. So look, I think there's an array of things in that question, right? So I think most organizations have the common challenge of Active Directory and M365 and whatever technologies they're using, at scale for their entire population. Healthcare has the added, we'll say, disadvantage you know, legacy tech to a good degree, right? I mean, sometimes devices will live in an environment for 20 years, and that's, I mean, that's lifetimes in technology, right?
Right.
So we're, you know, we're looking at, so number one, I mean, the biggest coaching I can give anybody is no matter what you do as you evolve, your new investments have to have good ways of leveraging your existing investments, right? It can't be a boil the ocean event, rip out a bunch of stuff, replace a bunch of stuff, impact end users. It'll fail, right? The other thing that I'm sure both of you will agree with is this is a never-ending game. This doesn't stop. You never really get to 100% in terms of identity, but the starting places to me are looking at, find the 20% that solves for the 80%. You know, you likely have in a hospital an array of nurses, right? An array of physicians, and these providers, while they may have different job codes, different roles, you know, whatever, there's ways to sort of manage their immediate access into things like like an EMR and like learning management, you know, things like that, right? Ways to integrate with the critical things that you know they're going to need in order to start adding value. Which, by the way, another point that hasn't come up yet is just the sheer cost of clinicians today, right? I mean, think about the volume of travel nurses that's happening. Think about the volume of contracted physicians out there. If we're onboarding them and they're left to sit and do nothing for days on end, not only does that frustrate them as a professional and leave a bad mark in terms of wanting to be with your organization, right? You're paying them to literally provide no value, right? So we have to find, you know, ways. So in terms of technology, to answer your question, Aaron, we see organizations moving more towards, honestly, SaaS solutions are becoming more common. Cloud capabilities are becoming more common. Looking at how to do things in standard ways at scale, incredibly common. And then finding technologies that integrate well into those selected stacks, right? And again, we as a technology organization have to be good at providing a fabric that allows that type of extended, you know, connectivity capability. The only other thing I'd put, and I'd be interested to hear Aubrey's feedback, not to throw something out of left field to you. APIs are an interesting thing. They're so useful in terms of, you know, so I can connect to something via REST, I can manage access and entitlements, whatever it might be. But to many organizations, they're the Wild West in terms of access, right? Developers are off creating things and delivering all this fun new capability, but who's governing that, right? How are we managing that? And so again, finding ways to look at things like least privileged and managing that type of service to service interaction, and setting that standard in course. You won't get it done overnight, but this is a, you know, kind of, it's a program, right? You keep pushing on it.
Yeah, Rob, so let me start with the APIs piece first. And you're right, it is kind of a bit of a Wild West, and I'd venture to say, not only in healthcare, other industries as well, folks don't know what APIs they have and what they're being used for, how they're being used, and whether there could be malicious activity occurring on those APIs. This is an area, by the way, this is an area where, again, to use those terms, those four letters, AI and ML, come into play, helping to go out and discover and helping to understand, you know, anomalous or behavior that is inconsistent with what looks like what should be normal behavior. So we can, you know, we can go out and audit, for example, and then, you know, control, you know, what data is flowing through those APIs. So that's an area where innovation has, again, handed us tools that, you know, enable us to at least, you know, monitor and have some intelligence as to, and really ultimately better secure, you know, electronic health records. You know, certainly sitting in front of, you know, so the Cures Act really focused on interoperability, the ability to support, you know, smart on fire, standardization. We talked about standards and protocols, and that's a standard that certainly Ping certainly supports from an interoperability perspective. So again, identifying the user, authenticating them, and then, you know, authorizing, making sure that their consent and authorization matches what they desire, tracking that, honoring that consent. Sort of all capabilities that exist today. The other area, and Ping is from the very beginning, Ping has been a very standards-driven company. So Rob, to your point, the adoption of SaaS apps, we can become that identity control plane that brokers that single sign-on access, consolidates access, makes the user experience more seamless, easy. With that, we can also, again, add identity verification, add risk signals, support intelligent multi-factor authentication, even things like passwordless. All those things can be integrated. And as organizations consolidate some of these platforms and modernize, some of the biggest projects that I've worked on recently, those are exactly some of the kind of key themes. But the other area, and this is I think another big shift in terms of integrations and how we integrate, is identity orchestration. So how do we stitch all these things together with as minimal code as possible, which can allow us to go handle and solve for those legacy apps that last mile integration is a lot more challenging. Let's make the easier stuff even easier. Kind of the idea that those folks that are administering these systems and need to integrate these different capabilities with the EMR, with other cybersecurity tools, with identity tools, we need to ship identity to various places. Let's make that as easy as possible for the stuff that supports modern standards. And then we can have some dedicated folks to address the legacy things, because we're going to live in a hybrid world for the foreseeable future. That's not going to change anytime soon. So those are some of the things that I'm seeing that relative to APIs, identity orchestration, low and no code type integrations that really are at disposal of our healthcare IT and security professionals to help them really, again, drive better outcomes and deliver better experiences. And Aaron, I know we're just about at that time, so.
Yeah, I think we'll wrap up here. It's always fun talking to you guys. I learned a lot just listening to you guys going through stuff for our audience. All three of us are pretty invested in watching and wanting the healthcare space to advance, just like the opportunities and outcome-based that Aubrey just mentioned. Our companies are too. So we welcome conversations beyond this too. So if you've got ideas, if you want to talk about how all three companies are helping to advance the healthcare space further, or other industries, we're certainly happy to do that. Like the new things that both Rob and Aubrey mentioned that Ping and SailPoint are doing, we want all healthcare companies to be doing that. We want companies to be following protocols and to advance so we can do more meaningful activities with our clients. We don't want to be cleaning up old legacy messes. We want to fix it once and move on. So if we can help do that, please reach out. So Rob, Aubrey, any closing thoughts from you guys before we wrap this thing up?
Look, the last thing for me, and truly thank you for everyone for your time. If you're interested in kind of evaluating where you land in terms of how SailPoint views maturity, you can look at, we've released it's a collaborative report we did with McKinsey. We called it, it's a Horizons of Identity report. It's a nice white paper, it's only like 10 pages long, so should be consumable. But there's like a little 6 to 8 questions or so you can answer to kind of help see where you exist in terms of that maturity relative to kind of some of the things SailPoint supports you on for identity. And then I believe, Aubrey, you've probably got some similar things relative to Ping.
Yeah, we have some of those same sort of calculators, and if sort of a more bespoke, business value or data is necessary as relative to maturity, we welcome those conversations as well. We can create some tailored things specific to the customer's particular set of data. So I'll make that offer. I'll leave you with a couple other thoughts, right? So healthcare is going digital. We've seen the threats continue to accelerate. I think there's some numbers out there, but average breach costs healthcare about just over 10 million. On the flip side of that, though, most of us, I think over 70% of us, want some kind of digital self-service experience. And I think it's in the this is from some survey data that Ping did. About 60% would switch to a competitor if they offered a better login experience. So I share those last data points because I think, we all share the same perspective that, again, integrating identity and leveraging identity as a lever can help innovate and drive better experiences, while also providing or striking that balance of convenience and security. So I'll leave our audience with those thoughts, and say thank you. Appreciate you attending. Thank you.
Awesome. Rob, Aubrey, thanks for the insights, guys. Always fun hanging out. Thanks, audience, for hanging out with us, and I'll chat again.
All right, great. Thanks.
Thanks, everyone.